Welcome all for Module 3 Bioethics. We are going to start with the lecture 1, that is Fundamentals of Bioethics. Introduction to Bioethics. Bioethics is a dynamic and evolving field that examines the ethical implications of advancements in biology and medicine. It intersects with various disciplines including philosophy, law, medicine, and public policy to address complex moral dilemmas arising in healthcare and research. The primary objective of bioethics is to provide a framework for making ethical decisions that respect individuals' rights, promotes well-being, and ensure justice in the practice of medicine and biomedical research. Understanding bioethics. Bioethics encompasses a wide range of issues from clinical decision making and medical research to public health policies and biotechnology. At its core, bioethics seeks to answer fundamental questions about how to balance competing values and principles in situations involving human life, health, and well-being. This involves applying ethical theories and principles to real-world scenarios to guide decision making and policy development. What will be the scope of bioethics? Bioethics is a multidisciplinary field that explores the ethical dimensions of advancements in biology, medicine, and related sciences. It extends across various domains including clinical practice, research, public health, and biotechnology, addressing a broad spectrum of moral issues and dilemmas. This lecture explores the diverse areas encompassed by bioethics, illustrating its relevance and importance in modern healthcare and research. The scope of bioethics is vast, reflecting the complex interplay between scientific progress and ethical consideration. Bioethics covers a broad range of topics. Clinical ethics involves the ethical issues that arise in patient care and medical decision making. Research ethics addresses the ethical concern related to biomedical research, including issues like informed consent and the use of human subjects. Public health ethics deals with ethical questions in public health policies and practices such as vaccination programs and disease prevention strategies. And environmental ethics, which considers the ethical implications of environmental conservation and the use of biotechnology in agriculture and industry. Clinical ethics, as we discussed, that clinical ethics pertains to the ethical issues that arise in the context of patient care. This includes everyday decisions about diagnosis, treatment, and end-of-life care. Central to clinical ethics is the principle of autonomy, which mandates that patients should be able to make informed decisions about their own health care. This involves ensuring that patients are provided with comprehensive information about their conditions, treatment, and potential outcomes. Informed consent. Informed consent is a key concept in clinical ethics, requiring that patients understand and voluntarily agree to proposed treatments. For instance, when a patient undergoes a surgical procedure, they must be informed about risk, benefits, and alternative to the surgery. Beneficence and non-maleficence guide healthcare professionals to act in ways that promote the well-being of patients while avoiding harm. Decisions about the use of life-sustaining treatments such as ventilators or dialysis often involve complex ethical judgments about the balance between prolonging life and ensuring quality of life. Public health ethics. Public health ethics focuses on the ethical issues related to population health and health policy. It involves balancing individual rights with the common good, particularly in the context of disease prevention and health promotion. Issues such as vaccination policies, quarantine measures, and resource allocation during health emergencies, for example in pandemics, are central to public health ethics. For example, as we all know that during the COVID-19 pandemic, public health measures such as social distancing and mandatory vaccinations raised ethical questions about individual freedoms versus public safety. The principles of beneficence is reflected in efforts to protect public health while justice addresses the need for equitable access to healthcare and resources. Bioethics in biotechnology. Biotechnology encompasses a range of technologies that manipulate biological systems for practical applications. This includes genetic engineering, cloning, and the use of stem cells. The ethical implications of these technologies are profound and complex. Genetic modifications of organisms, including humans, raises ethical questions about the extent to which we should alter genetic material and the potential long-term impacts on individuals and society. Cloning, whether reproductive or therapeutic, involves ethical debates about identity, the nature of human life, and the potential for exploitations. Stem cell research presents ethical dilemmas related to use of embryonic cells and the moral status of embryos. Now, third is environmental bioethics. Environmental bioethics extends the principles of bioethics to the interaction between humans and environment. It addresses ethical concerns related to the impact of biotechnology and medical practices on ecological systems. Issues such as genetically modified organisms, bioremediation, and the sustainability of biological resources are central to environmental bioethics. For instance, the introduction of GMOs into agricultural raise questions about environmental safety, biodiversity, and the potential consequences for ecosystems. The ethical management of biological waste and responsible use of natural resources also fall within the scope of environmental bioethics. Global bioethics. Global bioethics examines ethical issues from an international perspective, addressing the challenges that arises when biomedical practices and policies cross borders. It involves considering cultural diversity and ensuring that global health practices are equitable and respectful of local traditions and values. Global health initiatives such as efforts to combat infectious diseases in low resource setting and must navigate ethical considerations related to consent, community engagement, fair distribution of resources. Ensuring that international research collaborations respects the right and dignity of participants from diverse background is also a critical aspect of global bioethics. Now we will come to core principles of bioethics. As we all know from the first module that bioethics, a multidisciplinary field concerned with the ethical implications of biological and medical practices, relies on several core principles to guide decision making and resolve moral dilemmas. These principles: autonomy, beneficence, non-maleficence, and justice. It provides a foundational framework for evaluating ethical issues in healthcare and research. Understanding these principles is crucial for ensuring that practices and policies in medicine and biomedical research are conducted in a manner that respects individual rights, promotes well-being, and ensures fairness. First principle, that is autonomy, is a fundamental principle in bioethics, emphasizing the right of individuals to make informed decisions about their own lives and bodies. It reflects the respect for personal freedom and self-determination. In medical context, autonomy is manifested through the process of informed consent, where patients must be provided with comprehensive information about their medical conditions, treatment options, risk, and benefits before making a decision. Respecting autonomy means healthcare providers must honor patients' choices, even those choices differ from medical recommendations. For example, a patient may choose to refuse a life-saving treatment based on personal beliefs or quality of life considerations. Upholding autonomy involves not only informing patients but also ensuring that their decisions are made without an undue influence. This principle underscores the importance of recognizing and valuing individual preferences and ensuring that patients have the capacity to make their own decisions. Autonomy: patient diagnosed with cancer is informed about various treatment options, including chemotherapy, radiation, and surgery. The patient chooses to undergo chemotherapy after discussing the potential benefits and side effects with their physician. The doctor respects the patient's decision, ensuring their autonomy is upheld. Similarly, if patient decides in cases of cancer he wants to take any homeopathic treatment or if he wants to take any Ayurvedic treatment, then it is their own decision, and we as a doctor we have to respect the patient's decision, ensuring their autonomy is upheld. Autonomy in medical practice include obtaining informed consent before any medical procedure, maintaining patient's confidentiality. Informed consent means that patients are fully aware of the benefits, risk and alternatives of the treatment, enabling them to make an informed choice. Patient confidentiality involves protecting personal health information from unauthorized access, ensuring that patient's privacy is respected. Second principle, beneficence, involves acting in ways that promotes the well-being of others and contribute to their health and happiness. In the medical field, this principle requires healthcare providers to aim for positive outcomes by delivering effective treatments and interventions that improve patients' health and quality of life. Beneficence is about actively doing good and striving to benefit patients through medical care and support. For instance, when a physician recommends a treatment plan, the intention is to provide the best possible outcome for the patient, taking into account their specific needs and circumstances. Beneficence also entails a commitment to preventive care such as vaccination programs or screenings, which aim to protect individuals and communities from potential harm. This principle highlights the ethical obligations to act in the best interest of patients and to make decisions that enhance their overall well-being. For example, a physician recommends a vaccination program for a community to prevent the spread of infectious diseases. The program aims to protect individuals and promote public health, demonstrating the principle of beneficence. In practice, beneficence can be seen in actions such as choosing treatment that provide the most benefit to patients and promoting preventive care to improve overall health. For example, recommending vaccinations to prevent infectious diseases or implementing public health measures to reduce the spread of illness are acts of beneficence. Third principle is non-maleficence. Non-maleficence is the principle of do not harm. It emphasizes the obligation of healthcare providers to avoid causing harm to patients. This principle requires careful consideration of the potential risk and benefits of any medical intervention, ensuring that the potential for harm does not outweigh the expected benefits. Non-maleficence is fundamental to ethical medical practice, guiding healthcare providers to avoid unnecessary harm. Example, a surgeon decides against performing a high-risk surgery on an elderly patient with multiple health issues because the potential risk outweigh the benefits. By avoiding unnecessary harm, the surgeon adheres to the principle of non-maleficence. Examples of non-maleficence include avoiding harmful treatments and conducting a risk-benefit analysis before proceeding with any medical intervention. For instance, a physician might decide against a surgical procedure if the potential risk outweigh the expected benefits to the patient, adhering to the principle of do no harm. And the fourth principle is justice. Justice in bioethics pertains to fairness and equitable distribution of resources and opportunities. It involves ensuring that individuals are treated fairly and that healthcare resources are allocated in a manner that promote equity and addresses disparities. The principle of justice requires that all patients have access to necessary medical care and that decisions about resource allocation are made impartially. In practice, justice involves addressing issues such as access to healthcare, distribution of medical resources, and the fair treatment of individuals in research studies. For example, during a public health crisis such as pandemic, decisions about allocation of limited resources like vaccines or Ventilators must be made with consideration for fairness and equity. Justice also involves addressing social determinants of health and working to reduce inequalities in healthcare access and outcomes. Example of justice. Example, a hospital implements a policy to provide free medical care to low-income patients, ensuring that everyone has access to necessary healthcare services regardless of their financial status. This policy reflects the principle of justice. Justice can be seen in efforts to provide equal access to healthcare for all patients regardless of their socio-economic status. This includes policies that aim to reduce healthcare disparities and ensure that resources are distributed fairly among different populations. For example, implementing programs to provide healthcare to underserved communities reflects the principle of justice. Now we'll see application of these core principles. These core principles often intersect and can sometimes lead to ethical dilemmas where they come into conflict. For example, a patient's autonomy might lead them to refuse a life-saving treatment, which can challenge the principle of beneficence, where the healthcare provider aims to act in the patient's best interest. Similarly, issues of justice can arise when considering how to fairly allocate limited resources in a way that respects individual rights and maximizes overall benefit. Healthcare professionals and researchers must navigate these complex situations by balancing these principles and considering their interactions. Ethical decision making involves careful deliberation and often requires finding a compromise that uphold the core values of bioethics while addressing the specific context and needs of individual involved. Now we are going for a case scenario. Bioethics relies on several core principles, that is autonomy, beneficence, non-maleficence and justice, to guide ethical decision making in healthcare and research. These principles help navigate complex moral dilemmas and ensure that medical practices and research are conducted ethically. By examining case scenarios, we can better understand how these principles are applied and the challenges they present in real-world situations. Case scenario 1, autonomy in informed consent. Scenario, just imagine Ravi, a 50-year-old man, is diagnosed with progressive form of Parkinson's disease. His neurologist, Dr. Mehta, presents him with an experimental treatment options that has shown promise in clinical trials. The treatment involves a novel drug that could potentially slow the progression of his disease but comes with uncertain long-term effects and side effects. Dr. Mehta provides Ravi with detailed information about the treatment, including potential benefits, risk, and alternative options. Despite the thorough explanation, Ravi is anxious and overwhelmed by the decision. He seeks more time to consider his options and consults with his family before making a final choice. Ethical analysis, what will be? Analysis done on all four principles. That first is autonomy. The principle of autonomy emphasizes Ravi's right to make an informed decision about his treatment. Dr. Mehta must ensure that Ravi fully understands the information provided and that his decision is made voluntarily without coercion. Ravi requests for additional time and family consultation, respect his autonomy, and as it acknowledges his need for thorough consideration before making a choice. Beneficence. Dr. Mehta's role involves acting in Ravi's best interest by providing him with all necessary information to make an informed decision. The experimental treatment could potentially benefit Ravi by slowing disease progression, aligning with the principle of beneficence. Non-maleficence. This principle requires Dr. Mehta to avoid causing harm by thoroughly explaining the potential risk and side effects of experimental drug. Dr. Mehta ensures that Ravi is aware of the possible harm and can make an informed decision that minimizes potential negative outcomes. Justice. Justice involves ensuring that Ravi's decision-making process is fair and that he has equal access to information and options. Dr. Mehta must provide Ravi with the same level of information and support that would be offered to any other patient, ensuring fairness in the treatment process. In this case scenario, we have seen that all four core principles of bioethics are understood and explained to patient, and we got the desired result. Beneficence and non-maleficence in end of life care scenario, where Mrs. Patel, an 80-year-old woman with advanced terminal cancer, is receiving palliative care at hospital in Ahmedabad. Her family requests that all possible measures to be taken prolong her life. Even though the medical term believes that further interventions will only cause additional suffering without significant benefit. Dr. Shekhar, the palliative care specialist, must decide whether to continue aggressive treatments or focus on comfort care. Mrs. Patel has expressed a desire to avoid unnecessary suffering and prefers to spend her remaining time comfortably. Here, what happens in this case, we seen that Dr. Shekhar aims to act in Mrs. Patel's best interest by providing care that maximizes her comfort and quality of life. The principle of beneficence supports transitioning to palliative care, which aligns with Mrs. Patel's expressed wishes and seeks to alleviating her suffering. Continue aggressive treatment cause unnecessary pain and discomfort, which would violate the principle of non-maleficence. Dr. Shekhar must consider whether further interventions would inflict harm without providing meaningful benefit, thus prioritizing Mrs. Patel's comfort over potential harm. Autonomy. Respecting Mrs. Patel's autonomy involves honoring her wishes for comfort care and avoiding treatment she does not want. Her expressed preferences for minimizing suffering is central to decision making. And justice in this context involves providing equitable care that respects Mrs. Patel's wishes and ensuring that her needs are met with compassion and fairness. It also requires balancing the family's desires with the ethical obligations to prevent harm. Now, third scenario, justice in resource allocation. During a severe dengue outbreak in Chennai, the city's hospitals are overwhelmed with patients and there is shortage of blood transfusions and ICU beds. The healthcare team must decide how to allocate these limited resources fairly among patients with varying degree of illnesses. Dr. Kumar and his team face the challenge of prioritizing patients based on factors such as their likelihood of recovery, severity of illness, and overall impact on public health. They must make difficult decisions about who receives ethical care and who may have to wait. In this scenario, the principle of justice is central to this scenario, as the healthcare team must ensure fair and equitable allocations of limited resources. This involves making decisions that are impartial and consider the needs of all patients, aiming to distribute resources in a manner that maximizes overall benefit and minimizes harm. Dr. Kumar and his team aim to act in a way that benefit the greatest number of patients. Prioritizing patients with a higher likelihood of recovery can help maximize the overall positive impact of the available resources. Non-maleficence will be considered in ensuring that the allocation decisions do not cause unnecessary suffering or harm is crucial. The team must weigh the potential harm of denying care to some patients against the benefit of providing care to others. While the principle of autonomy is less directly applicable in this context, it is important to consider patients' preferences and values as much as possible within the constraint of resource availability. The team should strive to respect patients' wishes and provide compassionate care in the allocation process. This scenario underscores the complexity of applying the principle of justice in resource allocation, highlighting the need for fairness and equity in critical situations. Contemporary bioethical issues include genetic testing and screening, end-of-life care, reproductive technologies, and organ transplantation. Nowadays, student will undergo all these examples in a practice where new advancement has been done for genetic testing and screening, end of life care, reproductive technologies, and organ transplantation. Bioethics is a field that continually evolves in response to advancements in medicine, biotechnology, and society. Contemporary bioethical issues often reflects the intersection of emerging technologies, diverse cultural values, and complex moral dilemmas. To understand these issues better, we can explore several case scenarios that highlight the ethical challenges faced in modern healthcare and research. Each scenario provides insight into how bioethical principles are applied in practice and difficulties that arise when navigating these contemporary issues. Genetic testing and screening. Genetic testing and screening raise several ethical considerations such as privacy, informed consent, and potential discrimination. The use of genetic information must be carefully managed to protect individuals' rights and prevent misuse. For example, pre-implementation genetic diagnosis allows for the selection of embryos without certain genetic conditions, but it also raises questions about the ethical implications of selecting embryos based on genetic traits. Patient undergoes genetic testing to determine their risk for hereditary diseases. The results indicates a high risk and patient must decide whether to inform their family members who may also be at risk. The ethical dilemma involves balancing the patient's privacy with the potential benefit of informing family members. Long-term effects. The long-term implications of genetic modifications are not fully understood. Editing human genes, especially those in embryos, raises concern about unintended consequences that could affect future generations. There is a risk that the genetic editing technologies may exacerbate social inequality. Wealthier individuals or countries may have better access to these advancements, potentially leading to disparities in health and well-being. The use of genetic editing on embryos brings up questions about moral status of embryos and the ethical limits of human intervention in the natural genetic makeup. Privacy and genetic information. As genetic testing becomes more accessible, concerns about privacy and the potential misuse of genetic information have emerged. Individuals undergoing genetic testing for hereditary conditions may worry about how their genetic data is used by third parties such as employers and insurance companies. The risk of genetic discrimination, where individuals are treated unfairly based on their genetic predispositions, raises significant ethical concern. The principles of autonomy is central to the issue of genetic privacy. Individuals should have control over their genetic information and be able to decide how it is shared and used. Beneficence involve ensuring that genetic information is used to provide benefits and such as personalized medicine and preventive care while minimizing harm. Non-maleficence emphasizes the need to protect individuals from potential harm such as privacy breaches or discrimination. Justice requires that safeguards be in place to prevent misuse and ensure that all individuals have equal protection and access to genetic testing and its benefits. Access to experimental treatments. The issue of access to experimental treatments is particularly pressing in the context of life-threatening conditions for which no standard therapies exist. Patients with rare or terminal illnesses may face challenges in accessing cutting-edge treatments that are still in the experimental stage. Economic disparities and geographic barriers can further complicate access, leading to ethical dilemmas about who receives potentially life-saving treatments. The principle of beneficence requires that efforts be made to provide patients with access to treatments that could improve their health outcomes. Non-maleficence involves ensuring that experimental treatments are safe and that patients are not exposed to undue risk. Autonomy supports patients' rights to choose experimental treatments if they are fully informed about the potential risk and benefits. Justice highlights the need for fair distribution of resources and ensuring that all patients, regardless of their socioeconomic status or location, may have equal access to promising treatments. End of life. End of life care involves ethical consideration related to autonomy, quality of life, and advanced directives. Ethical dilemmas often arise when making decisions about withdrawing life sustaining treatment. Healthcare providers must balance respecting the patient's wishes and ensuring that their final days are as comfortable and dignified as possible. This involves difficult decisions about palliative care, pain management, and respecting do not resuscitate orders. Examples: a terminal ill patient with advanced cancer has an advance directives stating they do not want to be kept on life support. When the patient's conditions deteriorates, the healthcare team follows the advanced directives and focuses on palliative care, respecting the patient wishes and autonomy. In reproductive technologies such as surrogacy, in vitro fertilization, that is IVF, and genetic modification present ethical challenges related to rights of surrogates, the welfare of child, and potential exploitation. Ethical concerns include the implications of creating designer babies through genetic selection and the rights of responsibilities of all parties involved in reproductive arrangement. These technologies require careful ethical scrutiny to ensure fair and respectful treatment of everyone involved. Example: a couple uses IVF to conceive a child, and during the process they select embryos without a genetic condition present in the family. This decision raises ethical questions about the potential for designer babies and the moral implications of selecting embryos based on genetic traits. Organ transplantation. Organ transplantation involves ethical issues related to allocation of organs, consent, and the rights of donors and recipients. The fair distribution of scarce organs and the ethical consideration of living versus deceased donors are significant concern in this area. Ensuring that organ donation and transplantation practices are ethical and just is critical for maintaining public trust and ensuring equitable access to life-saving treatments. Example: a patient in a need of a kidney is prioritizing on the transplant list based on medical criteria. The ethical challenge is ensuring that the allocation process is fair and based on need, not on socio-economic status or other discriminatory factors. Nowadays, we are coming in the age of artificial intelligence. Even in healthcare, we have artificial intelligence, which is increasingly being integrated into healthcare for risks such as diagnostic imaging, personalized medicine, and patient management. While AI has the potential to enhance diagnostic accuracy and streamline healthcare delivery, it also raises ethical questions about transparency, accountability, and the potential algorithmic biases. Autonomy is relevant as patients must be informed about the use of AI in their care and have the option to consent or refuse AI-based recommendations. Beneficence involves using AI to improve patients' outcomes, while non-maleficence requires ensuring that AI systems do not cause harm, such as through incorrect diagnosis or biased recommendations. Justice necessitates that AI systems are designed to be equitable and avoid exacerbating existing healthcare disparities. Transparency in how AI algorithms are developed and used is crucial for maintaining trust and ensuring that decisions made by AI systems are fair and unbiased. Ongoing monitoring and validation of AI systems are essential to address potential biases and ensure that they serve all patients fairly. Global perspective on bioethics. bioethics principles can vary across cultures and societies. Understanding these differences is important for addressing ethical issues in a global context. International bioethics guidelines, such as those from the World Health Organization (WHO) and UNESCO, provide frameworks for ethical practices in diverse cultural settings. These guidelines help ensure respect for human rights and cultural values in bioethical decision making. For example, in some cultures, family members play a significant role in medical decision making. A healthcare provider must respect this cultural practice while ensuring that patients' rights and autonomy are also considered. Different cultures may weigh varying emphasis on autonomy, family decision making, and communal well being. For example, in some cultures, family members play a significant role, while in others, individual autonomy is prioritized. Understanding these cultural differences is essential for addressing ethical dilemmas in multicultural societies, ensuring that ethical practices respect cultural values and norms. Example: in a culture where communal decision making is valued, a patient's family may collectively decide on the patient's treatment plan, requiring healthcare providers to navigate these cultural norms while respecting the patient's autonomy. International bioethical guidelines. International bioethical guidelines are frameworks established to guide ethical practices in the field of biology and medicine on a global scale. These guidelines addresses issues like medical research, human rights, and environmental concerns. Some key international frameworks and documents includes the Declaration of Helsinki, developed by the World Medical Association. This document outlines ethical principles for medical research involving human subjects. It emphasizes informed consent, the necessity of scientific and ethical review, and the importance of considering the well-being of research participants. Second is the Belmont Report, created by the US National Commission for the Protection of Human Subjects of Biomedical and Behavioral Research. It establishes basic ethical principles and guidelines for research involving human subjects. Key principle includes respect for person, beneficence, and justice. International bioethical guidelines by UNESCO, suggested as the UNESCO Universal Declaration on Bioethics and Human Rights. Adopted by UNESCO in 2005, this declaration provides a comprehensive set of ethical guidelines for the protection of human dignity and the promotion of human rights in the field of biomedicine and biotechnology. The Council for International Organizations of Medical Sciences guidelines. These guidelines provide ethical guidance for biomedical research, especially in developing countries, addressing issues like informed consent and research ethics. International ethical guidelines for biomedical research involving human subject, which are developed by CIOMS in collaboration with WHO. These guidelines addresses the ethical conduct of research involving human subject, emphasizing the importance of ethical review and informed consent. And the last is Nuremberg Code, established after World War II. This set of principles is designed to ensure that research involving human subjects is conducted ethically. It emphasizes voluntary consent and the necessity of research being conducted for the benefit of society. This concludes the first chapter, that is Fundamentals of Bioethics. Now we will start with the second session. Before that, you have to go for assessment for MCQs, provided it will be only on the basis of lecture 1. Thank you.